And with that, we'll go ahead and get started. Hello, everyone. Welcome to this session of the 2024 Culture of Data Conference. Thank you so much for joining us and for your engagement and involvement in this, what will be a wonderful session. I am Wabine Gongo. I use she, her pronouns, and I will be moderating this session. We also have Alyssa Dalen, they, them, who is managing the Zoom and making sure the tech is running smoothly. If you have any tech issues or questions, please feel free to reach out to them or send them a private message on Zoom. You're all muted now, but if you have any questions during the Q&A sessions, please feel free to unmute at the end. We are saving questions for the end, but in the meanwhile, you can use the chat box if you have any questions or need anything. If you're comfortable doing so, please add your pronouns to your Zoom name by clicking the 3 dots on your video square and selecting rename so we may properly address you. This session was generously sponsored by CDPHE, and so we thank them so much for their contributions to this conference and their participation. I'd like to pass the floor now. Excuse me. I'd like to now invite Lillian Chimuma to share a few words.
Okay, thank you so much, Wibin. And I'm going to start off just by sharing a little bit about this topic and also and offer you some reflections that I'm hoping are going to guide us through this session, and also in general to reflect on this conference and what you're learning and gaining and how it ties into the grant-making process. First of all, thank you for being here this afternoon. And thanks to the presenters, they are looking forward to talking about this topic, and I'm hoping you're all excited to listen to them, especially in this critical area, and to actually highlight how it relates to the topic, data for social good. I would also like to thank CDPHE for sponsoring this session, as we've been said, but also for allowing the opportunity that I address you and to set up this presentation and upcoming session. So as a state agency, CDPHE administers and funds many public health efforts, from prevention to treatment and many other connected public health issues across the state. This is a noble cause that is always well intended, but especially in relation to reaching marginalized and minority groups that have historically, unfortunately, not well being represented in public health. Unfortunately, many times this effort falls short. Where does the problem start? Where does it end? Where do things go wrong or fall short? Now, while the COVID-19 pandemic brought this realization to the forefront, right, that we were leaving behind historically marginalized groups and minority groups, this is not an issue that is new to public health. Systemic, structural, and policy-related issues have historically deterred efforts to serve all populations equally and equitably. Now, these issues present challenging power dynamics that result in performative efforts by those funded and taking away the noble cause for the actual funding. When I think the grant-making process, I visualize the whole picture from where the program is first envisioned to where and how it is designed, to the implementation, to the outcomes, and even beyond. And to truly meet the needs of our communities with the funds that we provide, we have to be ready to think outside of the box with regards to allowing them the flexibility to engage in the grant-making process fully, empowering them to speak to their lived experiences through the data. I simply like to refer to data as information, and which they so generously share with us many times. While there is much I can speak about on this topic, I would not do justice to this topic without humbly allowing the opportunity for our presenters to really share what they have with us today. I will conclude with some reflection questions that I'm hoping you keep thinking about as you think about this presentation, reflect on the presentations you've already attended, and even look forward to upcoming ones this afternoon. Now, 3 questions that I'll leave with you. What does equity look like in the grant-making process? Where and when should we think about outcomes in the grant-making process? And to bring this back to our theme for this conference, data for social change, how can we leverage the power that is and of data to work towards equitable grant programming? Thank you so much. I'm going to give the floor to our presenters today.
Thank you so much, Lillian. We appreciate the thoughts for reflection and, again, for you speaking on behalf of yourself and CDPHE. Thank you so much for what you've already contributed to this session. And so we do have one presentation during this session. They will present for approximately 25 minutes, and then there will be about 10 minutes at the end for Q&A. We will leave time before our 1:15 cutoff to so I can just kind of announce next steps and what remains for the conference. And with that, I will now turn it over to Nicole Hardy and Ann Hill to present Advancing Equitable Grant Programming. Are we achieving intended outcomes?
Thanks so much for being and thanks everyone for being here. We're excited to share our work. My name is Nicole Hardy. I use she, her pronouns. I'm joined by my colleague Ann Hill, who also uses she, her pronouns. We will be tag teaming this presentation, so you go from each of us a little bit. We both work in the Resource Support Unit at the Division of Disease Control and Public Health Response. I'm an Equity Resource Supervisor, and Ann is an Equity Program Evaluator. First, we'd like to give some acknowledgement to Maya Contreras, an intern on our team who's been instrumental in analyzing a lot of our qualitative data that we are referencing today. And secondly, to our more than 60 sub-recipient organizations, so sub-recipients of our grant funding, who are really doing all the work on the ground, and that we are here representing that work and the work we're doing together. A financial disclosure that this work is funded by the CDC, and our presentation does not reflect the views of the CDC or Health and Human Services. Learning objectives for today are that we hope to summarize the inequities in grant-making infrastructure and programming practices to set the groundwork, state-specific efforts that are being made by the Resource Support Unit, where we sit, to advance equitable grant programming practices, and finally to evaluate whether or not our unit is grant programming practices are providing capacity building opportunities for organizations with limited state and federal funding experience. First, to set some background, if you were in Alyssa Dalin's presentation earlier, you heard them talking about the administrative parts of grant making, where there's some known research and efforts to make some progress here. So we'll talk a little bit about that here. So well-resourced organizations are well-equipped to apply for, receive, and successfully manage state and federally funded projects. And smaller organizations and communities of color, particularly smaller organizations run by people representing communities of color, are typically underrepresented in state and federal funding opportunities, such as those available through CDPHE. Barriers to accessing funding, such as budget policies, funder bias and requirements, and foundation roles and systems, have contributed to this imbalance of power. Beginning prior to the COVID pandemic and accelerated by the pandemic, along with social unrest during summer of 2020, there was a real big push to change the way that funders give out grants. In an effort to change the way funding is distributed to community, there's an effort by funders to confront these power imbalances, to streamline funding processes, and to engage communities in the development of solutions. For private foundations, this has looked like the shift towards trust-based philanthropy. For governmental funders, this is looking like questioning how processes can move more towards that trust-based philanthropy. There are still a lot of requirements from the federal government that we don't, at the state level, don't have the power to change, but we can make some progress towards that. And that's what we've been trying to do. Some background about where our team sits within CDPHE and how this work came about. So we sit in the Health Equity Branch within the Division of Disease Control and Public Health Response. The Health Equity Branch was created in June of 2021. And our Resource Support Unit sits within that branch and was created in early 2022 to intentionally support organizations through the grant process, from pre-application through award and project implementation. RFA 40624, the Health Equity and Immunization Funding Opportunity, is a CDC-funded grant program designed to support community needs, build local capacity to respond to COVID-19, and reach disproportionately affected populations with effective, culturally tailored strategies. This RFA is funded by two separate CDC funding streams: the Immunizations and Vaccines for Children and the National Initiative to Address COVID-19 Health Disparities Among Populations at High Risk and Underserved, including the racial and ethnic minority populations and rural communities. That was a really long set of names for funding, so we're going to refer to it as the RFA. This RFA is a mechanism for CDPHE to use these federal funds to award small dollar amounts, comparatively, amounts to primarily grassroots-style, community-based organizations that typically do not access federal or state funding due to what's perceived as, or might truly be, barriers for these organizations and communities to get and use funding at the state and federal level. The Resource Support Unit, you'll see a RSU abbreviation in many of our slides, serves as the technical assistance provider, contract monitor, and evaluator for the COVID-19 Health Equity and Immunization Fund, this RFA. How are we doing that? Well, we have a few strategies we use to advance this equitable grant making. There's an emphasis on outreaching organizations that have not previously accessed state and federal funds, or smaller organizations with limited experience with these types of funds. However, our funding opportunity is not limited to those organizations. Large organizations with plenty of experience working with the state and federal funds are absolutely eligible to apply as well. For today's presentation, we're going to focus on the strategies of targeted outreach, technical assistance, and advanced payment. When we talk about targeted outreach, we're talking about using data on geographic and population reach to identify priority organizations, contacting those organizations through various channels to learn about their work and discuss funding opportunities. When we talk about technical assistance, we're talking about regular, recurring virtual office hours, a shared inbox, and one-on-one meetings to identify the right type of grant program or funding opportunity, and to discuss if an organization's idea fits with the mission and priorities of this RFA. We also review application narratives and budget work plan templates with prospective applicants before they apply, and confirm the correct submission of grant materials. And we'll talk a bit later about how that technical assistance then translates to once we're working with funded organizations. And then finally, when we talk about advanced payment, we're talking about the fact that organizations can receive up to 25% of the total award at the start of the contract in order to assist with cash flow challenges that arise with reimbursement-based contracts. House Bill 2021-1247 made advanced payment possible within the state of Colorado. That House Bill 2021 tells you how recent that is. So advanced payment is new to CDPHE, and our program is the first to really operationalize that for CDPHE. So we'll talk a bit about those lessons learned alongside our targeted outreach and technical assistance. I'm going to hand things over to Anne to talk about methods and first set of results.
Thank you, Nicole. So we pulled a mix of operational and evaluation-based data to answer the question, is the Resource Support Unit, how are we, in fact, advancing grant programming and grant making for RFA 40624? The data was collected from approximately August of 2022 through January 2024, which spans basically the beginning of our grant application cycle to the last and most recent grant application cycle. Operational data is collected from information from the grant applications, as well as administrative tracking of TA calls and then outreach efforts. Evaluation data is used to supplement that quantitative data, and it really incorporates a mix of both subrecipient perspectives as well as our own staff perspectives. So we get subrecipient perspectives from progress reports, voluntary survey responses if they have in fact completed the contract, as well as meeting minute summaries during their regularly scheduled meetings with our equity resource specialists. We're able to get our staff perspectives through interviews. Next slide, please. So outreach is conducted by our equity resource specialists to large and small organizations across Colorado. And this includes agencies that are traditionally funded by CDPHE that really have a public health as well as a health-related activity or strategies, as well as non-traditional partners. And so Outreach goes to rural parts of the state, as well as it's targeted to organizations that work with disproportionately affected populations, especially those that were negatively impacted by COVID-19. Through January 2024, the RSU was able to outreach to 320 unique organizations, and this was done through email, through phone calls, and in some cases, community gatherings, which could include local coalition meetings or other community convenings. Of note, if organizations were really interested in learning more about the grant application, these organizations were encouraged then to attend regularly scheduled office hours, the technical assistance that Nicole described a little bit earlier, to better learn about the funding opportunity. The RSU opted to really revamp and ramp up outreach for our last and final cycle, and we were able to outreach to 52 organizations, and this certainly paid off because in that particular grant application cycle, we ended up getting a ton more applications received, and many of them also participated in the technical assistance/office hours. Of note, though, not all organizations that are outreached to end up applying to this grant. Obviously, there are reasons behind this. In some cases, it has to do with capacity, either the lack of expertise to be able to write the grant, or in other cases, it has to do with timing, or in some instances, the priority of the organization and the grant don't necessarily fit. Next slide, please. So, sorry for the dogs. They're a part of like every virtual conference. The original intention, as Nicole discussed about technical assistance, was that these would be office hours that were regularly scheduled where organizations could attend, and I'm really sorry about this, where organizations could attend and they could learn more about the grant application. This particular type, do you want to just go? Yeah.
So thanks for your patience, everyone. So the technical assistance that we were providing pre-application morphed to really providing ongoing technical assistance throughout the development of contracts. So really defining what the work is going to look like in a statement of work, refining that budget, and then throughout the implementation of the project to ensure that organizations understand what's required of them in their deliverables, in reporting. Importantly, because our funding is COVID related, there's a lot of details that are required to make sure that the work that's happening is connected to COVID-19 and immunizations. So providing that technical assistance to the awarded organization so that we are keeping everyone in compliance with the rules of the grant and that they're learning how to build their systems and supports along the way. That looked like providing customized reports and templates for our subrecipients to provide exactly what it is we're looking for, helping with data collection, large thanks to Anne, a connection to resources, brainstorming solutions, resolving invoices, and reporting challenges. And so these equity resource specialists on our team serve as liaisons, cultural brokers, and contract monitors for subrecipients. And this helps to improve communication and help move us towards equitable grant making. And I'm going to pass it back to you.
You got it all. Thank you. I think you are now, Nicole's going to take it back and she's going to talk a little bit about the applications that we received and those that were.
Thanks. Docs really wreaking havoc on us today. This slide gives a bit of a walkthrough of applications we've received and awards we've given and some of the details about those awards. So overall, we received 144 applications, and of those 144 applications, 63 applications were awarded. We've awarded over $10 million. 44 of the applications we received requested advance payment. 16 of those applications that requested advance payment were awarded, and then 13 decided to, in fact, use advance payment. We'll talk a bit about that, why there's that difference. 38 applications were resubmissions, so we glossed over this a bit, but there are multiple funding cycles, and so if an organization applied in an earlier round. They weren't awarded funding, we would provide outreach to that organization and work with them to better understand how their application could be strengthened and if this was in fact a good fit. So 12 of the resubmissions were awarded, 32% of our resubmissions were funded. And then just under half of the organizations that received technical assistance and ended up applying to our funds were awarded funds. We see overrepresentation across all geographic regions of Colorado. So the percentage of funds supporting a region is greater than the percentage of the population that lives in each of those regions of the state. And this advanced payment piece, right? So we're going to say a little bit more about this. This is a draw for under-resourced organizations and was thought by more organizations that ended up using it. I think I'm mixing up my slides, so I'm going to say this now, but probably another point on it later, that there's some burden that comes with that advanced payment. And so we work with organizations to help them understand if advanced payment truly is the right option for them. That's why some folks have decided not to use it. This table summarizes the number and percentage of all applications and all awards that serve specific disproportionately affected populations. This is a list of populations that are known to be disproportionately affected by COVID-19. Again, all of our funding is COVID-19 related. We know that these are populations that are often disproportionately affected by a variety of health conditions. So most of our projects benefit under-resourced populations, including minority and historically underserved communities of color or immigrant, newcomer, and refugee populations. And 32% of our projects serve rural communities. One note when you're looking at this table, the column, the percentages will add up to over 100 in each of the applications and awards columns. That is because this is counting each population that is served by a project. And we know that projects may serve more than one population. And we work to really understand who the focus of the project is. We know that the organizations we're funding have an open door policy. They're not going to turn someone away. However, we work to understand who they're say culturally tailoring their educational materials to reach a specific population. So that's what this is capturing. There's a targeted effort to really reach specific populations. And we used data on our awards and applications throughout each funding cycle to understand where we were or were not having good reach into each of those populations. Our team is really proud that we've been able to engage organizations that are serving currently or formerly incarcerated individuals, as well as organizations serving populations that identify as having disabilities, because these are organizations that do not typically access funds like this, and we know have layered and intersectional disproportionate impacts from COVID-19. And so we've just been really proud of our ability to have a focus on outreach in those populations and to award funds to some organizations doing some really great work. Remember when I said that I thought another slide about advanced payment? I sure did. So the resource support unit, as I said, is one of the first units at CDPHE to successfully administer advanced payment. As noted by our subrecipient funded organizations, advanced payment bridged the financial gap to do their proposed work and actually allowed these organizations with fewer resources to participate in grant activities. I mentioned earlier that an organization is eligible to receive up to 25% of their total award at the start of the contract. This is important because I'm sure most of you know about reimbursement-based contracts. That's how most of this work happens, where you do the work, then you submit an invoice, and you get that invoice back. The way that the state processes invoices, that can lead to somewhere between 45 and 90 days from the start of a contract to when you get your first invoice, due to how organizations process their own billing, and then the process to approve and release payments from the state. So when you receive that money up front, the goal is that it helps cover the work that needs to happen in those first 1, 2, or 3 months of the project. This is incredibly impactful for the organizations that opted to use this advanced payment because it's not uncommon for awards that we give out to be as large as the existing operating budget of an organization. I sometimes forget that, and I'm going to say it again. It is not uncommon for the awards that we give out to be as large as the existing operating budget of an organization. So this came with strengths. For some organizations, the advance payment made things more complicated. Understandably, the state views giving advance payment, giving money at the start of a contract before work has been done, as a high-risk activity. So they want to have some additional assurances that the organizations that are getting that money up front have appropriate policies and procedures in place and are following all of the federal and state accounting and purchasing rules. And so that puts an additional burden on these small organizations to comply with those requirements. It involves reviewing policies and procedures and additional levels of review on invoices. So although the upfront money to launch projects is very appreciated, that additional administrative burden can be a challenge. And as we've learned through, again, these rolling application cycles, we have some organizations that are further along in this process than others. We've been able to refine the technical assistance that we're providing to organizations and really help them understand what does it look like to take advance payment, and is that the right approach for them. Some organizations have decided that they want to spend effort up front, ensuring that they know exactly how to complete an invoice. Because if they get an invoice submitted on time and complete, they're going to get paid way faster than if we have to provide ongoing technical assistance to refine their invoices. And that can have the same impact as advance payment for some organizations. And so we work through that now with organizations to help them understand the best option for that. Okay. I'm going to hand it back to Anne and maybe some dogs to share some more.
So upon looking at our preliminary organizational and evaluation-based data and thinking through that question about whether the RSU is advancing equitable grant programming, we recognize right now that the RSU is implementing grant programming and processes with intentionality. And we're doing this in a few ways. First off, we're really working on building relationships across the aisle with CDPH&E and other units there and other teams, and as well as our own subrecipients. And when we think about building relationships at CDPH&E, the intention is to connect with other units and teams to share best practices, but also to learn about best practices, to connect our own subrecipients to additional expertise and resources and funding opportunities at CDPH&E as well. When we think about building those relationships with our subrecipients, these are organizations that, again, we had talked about beforehand. They're traditional and non-traditional in Colorado, and they're traditional and non-traditional as far as being able to receive CDPH&E funds. And it's really critical that we focus on ensuring transparent communication with these subrecipients because we want them to be successful. And we do that throughout the process of thinking through whether they're applying for the grant all the way through the entire contract. We also are working to build capacity, and this is done through via technical assistance, but the intention here is that we want those subrecipients to not only complete their project, right, to do it successfully, to be able to make that impact in the community, but we also want to build their capacity so that they feel confident and ready to apply for additional state and federal funds. Next slide, please. However, we recognize that there are some areas for improvement. Requirements and processes of state and federal funds, they can be cumbersome and overwhelming, and this can lead to a feeling for certain subrecipients that it takes away, all these requirements take away from the work that they're doing or trying to do, and instead they're focusing on reporting opportunities. And we also recognize that it could be that in some instances, sorry about the dogs. In some instances, do you want to take over this part, Nicole?
Sure. In some instances, the view is that the response is reactive instead of proactive in how organizations are working with our requirements, where we haven't been as forthright and upfront about all the requirements that are needed in a way that makes sense to those organizations, right? It's not necessarily that we didn't try to explain, but we weren't explaining it in a way that made sense. And so that reactive and retrospective approach to contract monitoring can leave our subrecipients feeling confused, or like they have to go back in time and try to figure out what was happening with their, say, invoice and their budgeting instead of doing the work on the ground. So our unit is learning where and when in the process it's important to be prospective and proactive to better prepare organizations for those requirements of contracting with the state, especially with federal funds. As we mentioned earlier, sometimes we're just the messenger, right? These are federal rules that we have federal funds, and this is just, that's what we need in order to pay for something, or that's the rule for what you're actually allowed to do with these funds. And we may agree that the work is great, and these are just the rules we have to work within. Go ahead, Anne.
Additionally, the time frame, as many of you are aware, specific state and federal funds often have a short time frame, and in some cases it can be less than 12 months. And this can feel quite limiting for subrecipients because it's hard to get work done in those 12-month time periods, and it can feel like there's very little time to actually make an impact in the community. Next slide, please. So overall, when we think about how are we using data for social change and whether or not the RSU is in fact advancing equitable grant programming and grant making, we have to sort of, again, go back to the data. And what we know right now is that the results don't show anything truly overwhelming quite yet. But we do know that we're doing important work. Specifically, we are laying the groundwork to improve equitable grant programming and grant making efforts across CDPH&E. And we're doing this in multiple ways. First off, as Nicole talked about, we are one of the first groups to really effectively use advanced payment at CDPH&E, and other units within our department are taking notice, and they're requesting assistance, they're requesting additional templates, they're asking for support because they're interested in seeing whether or not they can also tailor it to their grant programming opportunities. We are also advocating for and demonstrating the need for an equity resource specialist. As Nicole described, this equity resource specialist is a cultural broker and a liaison. And this individual is able to sort of balance the needs and the requirements from the state and translate that to subrecipients, and vice versa. The equity resource specialist can be extremely empathetic to the needs and the abilities and capacity of the subrecipients and be able to provide that information and translate that information back to the state. We also are advocating for continual technical assistance above and beyond those initial office hours that are offered to interested applicants for the grant. The continued technical assistance across the lifespan of the contract is so critical when it comes to ensuring that subrecipients complete their work, that they do it, they're able to actually implement their strategies and do it successfully, but also that we ensure that we build their capacity so that they're able to then want to and able to apply for additional state and federal funds. And that is the end. Thank you all.
Thank you so much, and Nicole and Anne's dogs. That was hilarious, I think. And but really, equitable funding is near and dear to my heart personally, and so I know I have so many questions. But at this time, we'd love to open the floor for folks here to ask any and all questions. Please feel free to drop them in the chat or go off mute, raise your hand. We welcome all questions now. Ellen.
Hi, everybody. Thank you for that presentation. Sorry, we could get everybody's face in front of me. Anne and Nicole. We have a lot of common cause here at Latino Coalition with what you all are doing at CDPH&E. And of course, we've worked on the Community Crime Victim Services Program with y'all for a while. I was just curious, as far as the with the advance, and I know that's like transformative for a lot of small committee partners. Can you talk to us a little bit about what sort of ongoing fiscal support you provide following the grant disbursement? Like, yeah, just would be curious to hear more about that. Thank you.
Sure, I can take this one to start. Full transparency, we've learned a lot along the way. We're providing more support now than we did earlier because we didn't know what we didn't know before. And so now we are better prepared. And so now what we're doing is explaining that there will be an early on in the contract a review of policies and procedures related to accounting and fiscal practices. That is something that is required during a contract with the state regardless. But the way that monitoring happens is set up for organizations that already have those policies and procedures in place. And it's mostly checking a box. And for the organizations that are receiving advance payment, they maybe don't have those, or they don't comply, or they didn't know it existed. And so we're learning to be able to share that information earlier on. And I'll be really honest, we should be doing better through this. The need is really great. The amount of administrative time and effort it takes to get those policies and procedures together is substantial. And I don't think we have the right answer of what that looks like, but so far that is every month we have meetings with our funded organizations to talk about program and also fiscal things. That is dedicated time every month is required in the contract. And then our equity resource specialists are always available via email. And then they are often the communicator and not always the person with the answer, but they'll come to their supervisor, they'll come to fiscal and make sure that they're able to communicate that answer back and call a meeting if needed and figure out what it is that organization needs to advocate along the way.
Thank you. And I meant to preface my question with just a huge thank you for everything that you're doing. It's amazing, as a government agency, it's an enormous thing to take on. So thank you for that work. And we certainly feel you. My colleague, Ava Lindquist, is also here today, but it is it's a huge lift. It takes a lot of just time. There's no way to rush it as far as, building these community organizations. So thank you.
Alyssa.
Hi, thank you so much for this presentation. I have a question. I was wondering if you could speak a little bit more and talk us through a bit of the actual review process for the applications when you received applications and how it worked to make those decisions about funding.
I can start again with this. So we have a set review committee. We have training for all of our reviewers. We do have scoring, but scores are not the final answer in determining where funding goes. I alluded to this earlier in saying we would review where our funding was going, right? So honestly, most of the organizations that are well equipped to manage state and federal funds are based in the metro area, right? And so we had a concerted effort to keep track of where our funding was going. And so all else being equal, an organization that was serving a population that wasn't well reached would receive funding over other applications. And we have a great conflict of interest policy to balance the fact that our staff are providing technical assistance to organizations. They don't review those applications. And then there is a leadership presentation where the leaders of our funding sources and kind of within our department provide guidance and give that final approval, similar to how an advisory board might do that for other funding sources. Anne, is there anything else to add about that?
No, but I think that you mentioned the multiple layers, and that's really critical. So that there's an individual, then a team review, then it goes up to leadership. And I really think that piece is, so there's multiple discussions so that it's not just one or two people making the decision as to whether or not the funding goes through. And I would say that as Nicole mentioned, what is huge, and it's a huge portion of like equitable grant programming and funding, is that if an organization's annual budget is $88,000 and they request $220,000, that is not considered in the application review. And I think that's tremendous. So, like, they could in fact receive that funding. So.
Lillian.
Yeah, thank you so much for that great presentation. One of the things that I'm reflecting on here, or kind of curious about, is how you engaged, and this might be coming more from my limited understanding of how your office is managing all of this grant making process and equity efforts. But I'm curious to know if you have engaged the programs with cross CDPHE to see what kinds of efforts they are either putting in towards the same or similar goal. And also, in a kind of similar line, how much have you actually engaged those communities that you are trying to reach in the process of understanding how you can improve this grant making process for them, besides, you know, the usual who's awarded or who actually applied and that stuff. Thank you.
You asked such really good questions. I'm like, so we spoke a little bit that we are reaching across the aisle to multiple groups at CDPHE to ensure that our subrecipients are connected to additional expertise to learn about other funding opportunities and resources. And most definitely, we're working closely, very closely within our health equity branch. Our health equity branch includes not only our unit, but there's another group that is regional coordinators, as well as disproportionately affected population liaisons. And we really work very closely with those groups because it has a regional connection to it. However, I think you bring up a good point that we probably need to go even further, and I'm not necessarily completely aware of all the work that's been done, but we need to think even further about other parts of CDPHE and working with those groups, because there's so much work that's going on. So I'm going to put that down on my list. When we think about engagement of the communities in the grant process itself, and when I believe what you're saying is like those that are directly impacted by the work that's being done by our subrecipients, and you're nodding, so yes. We have not asked them this particular question. We're using the subrecipients as a proxy. And upon finishing a contract, a subrecipient is asked a series of questions. It's voluntary, it's a voluntary survey, but they're asked, like, please talk to us about your relationship at CDPHE, how things went, what did you think about the application process, what did you think about writing a scope of work and the budget. So we get a perspective across the entire contract from the beginning until the end to better understand how things went. Did they like the rolling deadlines? Did they notice anything about that? What did they think about advanced payment? So that's one aspect. We're also pulling a tremendous amount from the progress reports. So, Nicole, did you have other stuff? Did that answer your question?
Yes, I was going to say thank you so much. No, it did. Of course, we can have more conversation later, because I'm really, like I mentioned, this is a topic that I'm really passionate about, especially as an evaluator. But thank you. I really appreciate that.
We are very cognizant, though, and I'm glad you brought this up, though, that we're not getting to the population that is being impacted. And that is, we've had many conversations about that too.
Thank you. I just real quick, do you cover overhead costs by chance? Is that part of the equitable?
Yes and no.
Okay.
I'm going to give a succinct and somewhat technical answer. Most of the organizations that we work with do not have a negotiated indirect rate, and we know that 10% de minimis does not cover all the costs that it takes. So we will work with organizations to say, hey, who's filling out your invoices? Do you maybe want to have that as personnel in your line item in your budget?
Okay.
Hey, well, your executive directors in all these meetings, why are they not in the budget?
Yeah. Absolutely. And can you briefly describe what is the health resource specialist? I noticed that they gave a lot of quotes and talked about, like after courting grantees, so it's no capacity or anything like that. And I'm wondering, because capacity and not having time, but there's also issues with like trust, right, in government entities and funding and all the red taping and all that stuff. So I was surprised that that wasn't called out, but the fact that they don't have capacity and time was. And so, can you tell me like what that role is, and if there really are bigger issues around trust and building those relationships with communities?
Sure. So our equity resource specialists there's a team of 10 of them who work directly with our funded organizations and are the ones who are doing that outreach and providing that technical assistance. For those who have experience with CDPHE, they also serve as the contract monitor. So they have a real big role. That sometimes that trust issue is challenging, and we're thinking about the best way to structure that, because the goal is for that equity resource specialist to be the trusted voice. And then sometimes they have to then serve a more heavy-handed role when an organization isn't complying with the terms of a contract. But our team is, I don't say this lightly, the most empathetic people I've ever worked with. And so they are fantastic at building that trust and great at speaking up about boundaries and saying, I can't be the one to have this conversation. It needs to be someone else. Like, this is what's going on. This is why I don't think this is quite right. This is what they need. And we're hoping to learn across CDPHE and how contract monitoring kind of works in different divisions to figure out what that looks like. What are the best practices that we can learn from everyone to do that in the best way?
Absolutely. Absolutely. Thank you so much, you both, for your presentation. This was so compelling. It looks like we're over, so feel free to hop off if you need to. But I just wanted to thank you all, or attendees. Thank you all for attending this session and for engaging in the Q&A. A few short announcements before you head out, if you're still here. Slides are available in Sched if you need to access it. You'll receive an evaluation via email once the conference is over later today. Please take time to fill out, even if you attended a portion of it. It's very helpful. We do use the feedback that we get to inform the next year's conference. And if you fill it in within the first 2 weeks, you'll be entered for a raffle of $50 gift card, one of two. And so please, we would be very humbled if you took our evaluation survey. So now we'll have about a 15-minute break before the next concurrent sessions begin at 1:30. There will be 2 sessions to choose from at that time. See the full schedule again on Sched for the the workshop sessions details. And yeah, thank you all for attending. Thank you to our speakers so much and our sponsor. We really appreciate your being here and your sharing of this wonderful information. Again, I will follow up personally. So thank you so much.